doing exercises on a daily basis, or at least sometimes in a week, is very important in keeping our physical and mental health in a good way. Now, what are the types of exercises? And these exercises should be tailored to different body types. And the answer for this is definitely yes. There are three major categories of exercises, which are broadly named like aerobic exercises, anaerobic exercises, and agility exercise. The aerobic exercise work mainly on handling or delivery of the oxygen properly to the body tissues, especially the important organs like the heart and the brain. And the second kind of exercise is the anaerobic exercises, which usually work in non-oxygenated part, which is the increasing of the body mass or the muscle mass. And this is for the people who need only to increase their body mass and to burn fat in their bodies. And the third type of exercise is the agility exercise, which is needed by the people who do other regular sports like cutting edges sports and changing directions, need coordination like tennis, football, squash, cricket. People who do this exercise usually need to have some other exercise to be able to change direction, to keep the coordination between the brain signals and the body reactions to these activities. Next point is what is the duration needed to do this exercise? As we told before, it depends on the kind or the type of the exercise. If we do the aerobic exercise, which is usually like simple walk, simple mild uphill cycling, or little cardio exercise, this should be mild to moderate intensity and should be around 20 minutes, then have break, then can resume back. Then if we go to the anaerobic exercise, which is high power exercise like lifting heavy weights, like jumping with a high jump with rope, or doing any marathons or something like this, should be shorter time, like 2 minutes, then resume to maintain the blood flow properly to the vital organs. And the other agility exercise will be depending on the intensity of the other sport, like the tennis or the football. So this should be programmed with the coach or with the teacher who teach how much time needed to do that. Next, we will talk about the benefit of the exercise. Does it affect the heart rate and the fat burn and the metabolic rate? Yes, definitely. As we told, the aerobic exercise work on oxygenation of the tissues. So this deliver proper oxygen to the vital organs like the heart and the brain, as we told, which improves the heart rate, reduce the blood pressure, reduce the risk of getting type 2 diabetes, reduce the risk of getting strokes or cardiovascular disease, and increase the bone mass and reduce the chances of getting osteoporosis. Regarding the fat burn, the anaerobic exercise work, as we told, in anaerobic conditions. So it means that the body burns the fat to get the proper mass power, and this improves the metabolism rate.